12%. That's the share of American adults now taking a GLP-1 medication. Things like Ozempic, Wegovy, Mounjaro, Zepbound. That's 1 in 8 people. That number more than doubled in the past year and a half. These drugs have driven more prescription spending growth than any other drug class in the history of American medicine. Semaglutide and Tirzepatide are now the top 2 drugs by total dollars spent in this country combined. I want to be completely clear about my position before we go anywhere else on this. I think GLP-1 medications are genuinely remarkable. They are changing lives for patients who have struggled with obesity for years and sometimes decades, and dealt with all the cardiovascular risk, the joint damage, metabolic disruption that comes with it. These drugs are delivering results that nothing else has. I prescribe them. I believe in them. But I also see what happens after. I see the patients who lost 60 pounds in 8 months and now have skin that didn't come with them. I see the faces that look 10 years older than they did before the weight came off. I see the breasts that are deflated, the arms, the inner thighs, the bodies that won the metabolic battle and then came to me to figure out what to do with the aftermath. That's what today is about. Not to scare you off these drugs, not even close, but to give you the complete picture that your prescribing doctor probably didn't, because that's not their department. It's mine. Welcome back to Honestly. I'm your host, Chris Lee, MD.
And I'm Jenna Gomez, aka Big Body.
And today we are talking about GLP-1s. So let's just get right into it. Jenna, what's the most common things people are calling you about after being on GLP-1?
Mainly that they've lost a ton of weight and they feel like their face is sagging and looks holy, or, they've lost a lot of volume mass. Also, their skin is sagging and they have it's just a lot of loose skin.
Yeah. And this is something that no one really warned them about. I mean, obviously people have heard about it more today with Ozempic face, but the prescribing doctors aren't really worried about this. This is not like their area of expertise. This isn't what they're concerned about. They're obviously concerned about the health risks of being obese and overweight, and not really what might happen to your face. And that's just not in the endocrinology workflow.
Right. And it is pretty drastic. Once you've lost a bunch of weight, I mean, kudos to you, but there's a lot of volume loss. So
Totally. So let's get into let's start at the beginning of what GLP-1s actually do. So GLP-1s are a hormone that are naturally in our body. It's a glucagon-like peptide 1. It's a hormone that's found in the gut. And what it does is it signals fullness. So when your gut expands, it releases this hormone and it makes the rest of the body kind of realize it's full. It slows stomach emptying and it triggers an insulin release. Now, the synthetic form of GLP-1 is semaglutide, or also known as Wegovy or Ozempic. And then there's Tirzepatide, which is GLP-1 plus a second receptor called GIP. And what that does, so both of these drugs work, or the GLP-1 works on the brain and the gut mostly, as well as other pathways in the body, sort of biochemical pathways, to better control glucose surges in our body. And it's glucose surges in our body that causes us to gain weight. And what the GLP-1 does, as I said, is it slows down gastric emptying, so you feel full faster. But it also works in our brain to kind of make us feel full a little faster and make us have that sensation of it kind of gets rid of that need for snacking and sort of that food noise.
Okay.
Now, what the GIP does is it counteracts one of those receptors in the brain that GLP-1 causes, that causes nausea. So it's less nausea than just the GLP-1 alone, but it also increases its ability to work throughout the body on the glucose reactions, as well as sort of other biochemical pathways, so that it makes you lose weight faster.
Okay. So essentially it's a longer, stronger version of the signal that your body's already giving you.
That's exactly correct. And it really cancels out that food noise, is what a lot of our patients and those of us who have tried it have said. Patients describe it as the first time in their lives that they felt sort of neutral about food rather than preoccupied by it. And that's not nothing. That's profound for someone who has been fighting that signal their whole life. And this is why it works when willpower-based options haven't. It addresses a biological signal and not a character flaw. That's why it's worked for so many people. Clinical trials have shown that with semaglutide, the patients have found about a 15% total body weight loss. On tirzepatide, that goes up to about 21%. There's a new drug that's kind of circulating, retatrutide, that gets almost up to 30%. So things are getting better and better. And what really happens, so those are clinical trial data. In real life, what they've seen is more along the lines of 7.7% or 8% for semaglutide and about 12.5% weight loss for tirzepatide. For a number of reasons, there's that difference. It's still a significant amount of weight loss, but there's always the people who are, have gaps in treatment, who stop their treatment before the end of a year, who and that can happen for lots of reasons.
People stop
People
less than a
absolutely,
year.
yeah, people will absolutely stop for a couple reasons. The most obvious is cost. There'll
Yeah.
sometimes be people on these meds that are getting it through insurance that
Mhm.
then eventually either their insurance stops or changes and they can no longer afford it because it's no longer covered.
But also, if you think about it, all the food that you're not having to buy because you're not hungry, you are saving money there.
That's true. So there's a little bit, yeah.
Okay.
Now that is true unless it's $1,000 a month. $1,000 a month is a lot to pay, and I get that.
That's true.
And if you're just buying it over the counter, it can cost up to $1,000. Other reasons why people stop are side effects, nausea, GI distress. Generally, as I said before, that's worse with the GLP-1s alone in semaglutide, but sometimes that's enough to stop people, especially if
Yeah.
that's the only thing that their insurance will.
Right. I actually took semaglutide and tirzepatide. I tried it once. So the semaglutide I was nauseous. I felt pregnancy nauseous for, I think the whole week.
Yeah.
Tirzepatide, I felt nothing,
Yeah.
like no side effects except for I wasn't hungry. I did.
Yeah, and that's a pretty common thing, and some people are just too scared to try tirzepatide after they've tried semaglutide.
Would be too. Honestly, semaglutide killed me. I
Yeah.
thought I was pregnant again. Yeah.
And then there's a subset of people who reach their goal and just decide to stop. Stopping is totally fine. There's no real side effect to that, except for the fact that a lot of these people will have rebound weight gain.
Yeah.
And we'll talk more about that, but certainly the data has shown that that is the case. These are really considered maintenance medications, something that you kind of have to keep taking. However, in my practice, what I've seen, and since we sell semaglutide and tirzepatide, I've found that the people who are buying into this and investing in themselves tend to do better than people who are getting it from insurance alone, because they have that buy-in. What happens is mentally, they're like, okay, if I'm going to spend this money, I want to make it worth it. So I'm going to change this, and this. So I'm going to eat better. I'm going to work out more, and I'm going to take this medication because I have a goal in mind and I want to reach that goal, and I'm hoping to get off. And what I've found is that people who have major lifestyle changes and use this drug to get to that point to make it easier tend to do well and some of them continue to lose weight after being off the stuff, just because they have kind of taught themselves what they need versus what they want. And that's a big difference. So who's on these? About 1 in 4 current users are just using this for weight loss. So no diabetes at all. Women are a significant majority of the patients on these. Average ages 40s to 50s. And here's the aesthetic relevance and why we're talking about it today. Skin elasticity declines with age. So the patients most likely to be on these drugs are also the patients whose skin is the least equipped to handle a rapid fat loss. That's not a reason not to take them, but it is a reason to plan ahead.
Yes.
So let's talk about the face. What happens to the face when we lose a bunch of weight because we're on GLP-1s? So your face has a lot of specific fat pads and pockets that sort of make up the volume in your face, in your cheeks, in your temples, in your under eyes, jawline. All these places have multiple fat pads, some deep, some more superficial. And when you have weight loss of any sort, your fat cells in your body are a finite number. As you gain and lose weight, those fat cells don't multiply or get lost. They just expand and contract as sort of fat storages and storages for essentially what is energy, right?
Yeah.
So when you lose weight and lose it rapidly, you're going to lose weight from anywhere you have fat pockets, or lose volume from anywhere you have fat pockets. But the skin on top doesn't always shrink at the same rate. And what happens is you have volume depletion underneath skin without structure to hold on. So you become hollow, gone, and prematurely aged.
And that part is really true. I mean, I've seen patients who are, my age and they look just so much older because of the volume loss
Yeah.
problem.
And obviously it matters
Yeah.
how much volume you're losing,
Right.
but it can certainly make a difference.
Mhm.
The American Society of Plastic Surgeons quoted a 50% increase in facial fat grafting in 2024 over the
Wow.
previous year
Wow.
because of GLP-1s. And
Wow.
1 in 4 plastic surgeons expects to continue growth in fat grafting because of these medications. So,
Wow.
this is clearly an issue that we're addressing as a society, but there's always going to be some more ways of figuring this out, and things will develop as we go. Really, we should shift gears from away from just treatment, but also kind of prevention.
Right.
Essentially, what happens is their body got what it wanted, but their face went in the opposite
Yeah.
direction. So, and this isn't really predictable. Everyone's skin is going to be different. Where people lose and gain weight faster is going to be different in people. Genetics, skin quality, speed of loss, and dose titration all matter. There are certain cultures that have thicker skin that I find retracts better, even with
Yeah.
things like liposuction. So you're always gonna, you never really know when you start these meds how it's gonna
Yeah.
play out, but there are some things that can sort of hint at what things might be like.
Okay. So what can people do to proactively stay ahead of it?
Yeah, that's a great question. So if you only have a smaller weight loss or a mild volume loss of your face,
Mhm.
things like hyaluronic acid filler are great. Biostimulants can help. Targeted filler to replace the areas of volume loss that you've had.
Mhm.
Now, anything moderate to significant, I usually recommend something a little bit more aggressive, like fat grafting, using your own fat harvested and processed and transferred to your face. There is a little bit more recovery, obviously, but it's whatever remains, whatever grafting stays is a permanent change. And it's going to always be a little bit more natural than filler. So, and filler, you kind of have to do at
Like
least once
redo.
a year or
Yeah.
once every year and a half. Are there things that we can do proactively? Absolutely. And this should be happening at the prescribing level, the people who are actually giving this medication, but obviously they're not trained in this. So let's talk about it. So titrating slower, not losing the weight as fast can help allow your body and your skin to react a little bit better. I think the goal for me when I'm prescribing these medications is I'm very happy at 5 pounds a month. 5 pounds a month, I think, is perfect. I don't like my patients going much faster than that because that's when you start to get into issues with some skin laxity. Other thing to remember, making sure that you're loading up the protein, making sure you're trying to prevent any muscle wasting or as much muscle wasting as possible. Because in the end, that's going to happen if you're eating less.
Meaning lift more weights.
Absolutely.
Okay.
Lift more weights. Make sure you're eating at least zero 0.8 to 1 gram per kilogram of your body weight to preserve that muscle and facial tone. Resistance training, as you say. And then the final thing is treating your skin well. So obviously, this starts at a young age by staying out of the sun as much as possible. UV definitely damages elastin and collagen in your face, in your body, in your skin. But the other things you can do if you're starting these medications and you are worried about it is you can do things like anything that's going to stimulate collagen. So that's microneedling with radiofrequency, so Morpheus, other radiofrequency techniques like face tight or accutite, and then biostimulants like Sculpture or Radiesse. All those things use low grade inflammation or controlled damage to the skin in order to promote collagen deposition and reproduce. Yeah, so the body's always healing, and that helps kind of, I don't want to say shrink the skin, but it helps the skin react a little bit better.
Shocks it.
The Honestly scale for prescriber preparation for the patients. So how well is the medical community preparing GLP-1 patients for aesthetic consequences? 3 out of 10.
What?
Media, it is sad. Media does a good job. Media is there to scare us.
Yes.
So everyone's heard of Ozempic face, but that mostly comes from media and social media. Prescribers, that's not their goal. And I can understand. No one's handing their patients a pamphlet that says, here's what might happen to your face or body. And that doesn't exist, but maybe it should.
Yeah. Well, that's why we're here.
Exactly. It's not malicious. Medicine is siloed and everyone has their own sort of area of expertise. Endocrinology and plastic surgery don't historically talk to one another. So patients find out on their own in 6 months, often by looking in the mirror or looking on Zoom and seeing and not recognizing the face that they're looking at.
And for women too, it's also so hard. We see a lot of women who are like going through their hormonal changes. And I mean, it's just sad because there's so many things. They finally lost the weight.
Right.
And then
Just melting. Don't worry though.
we got you.
We got you. So everyone's heard of Ozempic face. I think probably a bigger issue, both medically and cosmetically, is actually what happens to the body. Face gets all the press because that's what everyone's talking about. And it's obviously the first thing people see. And bodies can be hidden
Yes.
very easily. But bodies where the real surgical consequences are more dramatic. And when we get into bigger operations. So if you lose 50 plus pounds rapidly, the skin of the abdomen, the arms, the inner thighs, the breasts, they don't contract at the same rate. It's just not going to happen. I mean, unless you're like in your early 30s, maybe late 20s, when your skin is really healthy, like it's just that amount of weight loss is always going to lead to some amount of excess skin.
Yeah. And that honestly surprises so many people. I guess I didn't really know about it either, but that does surprise a lot of people that they're like, wait, it's not going to like shrink as fast as I'm losing weight.
Yeah. And I think the longer people are overweight or have that excess skin, the harder it is for the skin to come back. You know, elastic fibers have their limit, right? And once that limit of contraction is exceeded, they just aren't going to bounce back any further. And this is the case with liposuction as well. So it's not just fat loss, but anytime you're removing sort of that volume rapidly and the damage is permanent, and there's not really anything that you can do other than surgery at that point. And no one really likes to hear that, but it is the truth. And we have to deal with that consequence all the time. A slower, gradual weight loss, skin can sometimes adjust, as I said, especially in younger patients with good skin quality. Yeah. That's redundant. What's talked about even less than body is breast.
Yes. Yeah.
And we see this all the time. The breasts are made up about 40 to 70% of fat, which makes up the breast volume on any given patient. Usually on older patients, that percentage is higher as some of their breast tissue their glandular breast tissue turns into fatty tissue. What happens after sort of hormonal changes and menopause and things like that.
We go through so much.
You really do.
We do.
It's not easy.
It isn't.
Like, you want to talk about it?
No, because I'm not that old yet. I haven't experienced anything.
Nothing has happened. She's perfect in all ways. And completely natural.
Very. Okay. I haven't tried lipo.
Never.
Tried Botox. Okay. Back to the deal.
And GLP-1 weight loss is systemic. As I said, all weight loss is. So you lose it from everywhere and you can't target where you lose it. This is what really pisses me off.
What? Tell me.
When people are like, oh, I have the best exercise to target your abs, like, oh my God, it's gonna melt the fat away. It's like, it's not a thing. It's not a thing.
Like, you mean they're saying they have an exercise or they have a tool? Because I bought all the tools. I bought everything.
Unless that tool is actually targeting those fat cells and killing them.
Right. That's true.
It's not a thing.
It's not a thing, but I've fallen for it, so it's fine.
Yeah.
No one's
we all do. So, and everyone wishes there was a magic pill for any of this stuff.
Yes.
But
created that yet.
It hasn't happened. And when I do.
Are you a doctor?
Just barely. I play one on podcasts.
Yeah.
Hours. Quick little training session. Yeah. So patients who lose significant weight on these medications will frequently experience breast deflation and accelerated sagging.
Yeah.
So happy breasts turn into very sad breasts.
Yes.
Looking at the floor. And this isn't a fringe case. This is common. Happens all the time.
And it's going to happen honestly anyways, because I mean, as we age, they're going to sag. So it's okay.
Absolutely.
Yeah.
Any hormonal changes, breasts change.
Yes.
Menopause, breast change. After kids, breast change. So this is just another one of those things. And a reason why it's really tough to be a woman.
It is.
But there are treatment options.
Okay.
Unfortunately, mostly surgical, but
yes,
still treatment options. You could have a breast lift
mm-hmm.
just to restore sort of, or get rid of the sagging, but keep the same amount of volume. That'll give you a very natural look. You could do a lift and an augmentation. So that will lift and restore volume in your upper pole.
Yep.
Exactly. And give you that upper pole volume that you can't get with just a lift alone. And certainly you can try fat grafting in areas where you want more volume and want like upper pole volume, but fat grafting tends to take sort of the shape of whatever you have, just increases the volume of it. GLP-1 makeovers are absolutely a thing. So American Society of Plastic Surgeons in 2026 trend is being called out that GLP-1 makeover is going to be named the leading plastic surgery trend of 2026. There's been a volume surge in liposuction and tummy tucks, 7% and 5% respectively year on year, driven mostly by GLP-1s.
Wow.
Body contouring spending more than doubled in Q1 of 2024 versus Q1 of 2023.
Wow. That's pretty cool.
Yeah. So,
That's
you know, it is, I mean, it's been great for us.
Yeah.
But at the end of the day, my goal is not to put scars on people. My goal is
Yeah.
to give people what they want with the fewest scars possible.
Yeah. But how exciting to like lose all this weight. You've worked so hard, you've had it your whole life, lose all this weight, and then you can fix it and give them the body that like they've always wanted. I think that you're making dreams happen. Like you're losing the weight and you're making bodies beautiful, like enhancing them.
Look at you.
Look at me. I'm just stating facts. That wasn't even a compliment.
Keep going. Keep going. The drugs deliver the metabolic result, which is
Yeah.
super important, helps with osteoarthritis, helps with obviously obesity, helps with cardiovascular disease. And then surgery comes in and completes the transformation that medication can't do alone, which is great.
That's awesome.
Yeah. They're very complementary tools and they're not competing.
Cool.
So let's kind of talk about GLP-1s in surgery since we bring it up. If you're on a GLP-1 and thinking about surgery, I personally tell my patients to wait until they're a stable weight.
Yeah.
Not necessarily their goal weight, but a stable weight, something that they can maintain, because it doesn't make sense, one, to do your surgery too early and then lose a
No.
bunch of weight,
Yeah.
and two, to do your surgery at a weight that you can't maintain
Right.
and then gain weight after.
Right.
So you have to decide sort of whether you're going to be on medication and how to stay stable on or off of it.
Okay, so patients hit their goal weight and they immediately start Googling surgeons.
Yeah, this happens all the time.
Yeah.
People are excited. And I understand. I mean, like, this is the first time they've looked like this, at least in clothes. They're ready.
Yeah.
And they're like, I just need the rest of this taken care of.
And just because you're on GLP-1, it's still hard work. It's like you're doing a good job.
Yeah,
Like you still have to work at it.
absolutely. Any amount of weight loss is great.
Yeah.
It doesn't matter how you get there. Everything that we do, we have tools to get to,
Yeah.
whether that's the gym, you know, a nutritionist, GLP-1s, everything all works together. So kudos to anyone who loses the weight anyway, especially if it's something that you struggle with for so long.
Right.
But certainly I think there should be some sort of waiting period where you're building muscle, optimizing your protein.
Yes.
If you're thinking ahead, using those non-invasive skin tightening treatments, taking care of your skin
Yeah.
to try and help it respond as best as possible,
Mm-hmm.
and then come in. And I think certainly planning ahead and coming to see us initially, great.
Yes.
And then as we plan for your surgery, just know that that's sort of our goal, is to
Right.
get you to a place where we feel like you're stable and you're ready to move forward. So let's hear from our listeners. Our single listener. We have some questions, so let's go over those. All right. So I've lost 40 pounds on Wegovy in 7 months. My doctor says I'm doing great, but nobody mentioned anything about my face or skin. Should I be worried?
Well, first, congratulations for losing the 40 pounds. That's huge. But if nobody mentioned the aesthetic side of it, doesn't necessarily mean you've been lied to, just misinformed.
Yeah. Or like
So-
not incomplete or not complete information.
Correct. Yeah.
Which is, you know, understandable, as we said. The face often shows weight loss faster than the body because
Yeah.
the amount of fat that's in your face is a lot less and the
Yeah.
fat pockets are a lot smaller. So you tend to see that a little faster than the systemic fat loss. At 7 months, if she continues, and depending on what dose she's on or whatever, it's possible she could still be losing weight and she may not be at a stable weight yet. So the things that I would focus on would be making sure your protein is up, making sure that you're building that muscle as best and maintaining that muscle as best as possible with weight training and resistance training and not
Yeah.
cardio.
Yeah. Weight training, heavy weights.
Yeah, it's definitely a different change from what people are used to. You're still going to burn, anytime you're weight training, you're still going to burn calories,
Yeah.
but in a different way.
Fat too.
Exactly.
Yeah.
Exactly.
So
But always can book a consult with a facial plastic surgeon now and then plan for something to be done at some point once you kind of establish that baseline.
yes. Absolutely.
All right. Question 2. My husband just started Ozempic, and I'm worried he'll look gaunt. He's in his 50s. Is Ozempic face more of a risk for men? Men are not immune.
Can men get something? Can you guys just get something?
We can.
Okay,
We
good.
can.
Good.
We can. The pattern tends to be a little bit different in men. Men tend to have more subcutaneous fat or subcutaneous facial fat, so fat directly under the skin, as well as thicker skin, more sebum in the skin, so that, or more oil glands in the skin, so that kind of helps their skin look a little bit more youthful for a little bit longer. And that acts as kind of like a structural buffer. The other thing is men carry a lot of their fat, their excess fat, centrally. So So around their visceral organs. So when they lose a lot of their weight, it tends to be in that area where they've lost. So while they may not look as bad in the face, their bellies might be a little bit worse.
What about like their neck?
Absolutely. Neck and jowls are absolutely a bigger thing, a more of a concern for men. And everyone's seen sort of what happens as everything sort of melts away.
Yeah.
Certainly can happen in men and women, but anytime you have that rapid weight loss and you don't have the skin elasticity, that is always a risk. The turkey neck and the jowls.
Yeah, or like this.
Yep.
Mm-hmm.
The arms tend to be more of a woman problem.
Of course.
Can certainly happen in men.
Of course.
Yeah.
Well, I was speaking to the women.
Yeah. Unfortunately, women get that anyway, and that's a very genetic issue, and we deal with it all the time. Could be dad. Could be thanks, dad.
Yeah.
You get half
Well,
your dad.
I actually have it. I do. That's a lie. I do. I just work out with cattle.
Yeah. Plug. So, same core advice, slow titration, protein, resistance training. If he notices changes that bother him, then come in earlier. Earlier means less intervention. Again, treating that skin, trying to get it to respond as best as possible for that weight loss.
And also, I feel like, as you were saying, come in earlier to get a treatment path, and you might be embarrassed, but it really does set you up for success. And I know here in our office, we want to see you, we want to help you. So don't be embarrassed. Just come in, let's get a game plan. Let's, get your skincare.
Yeah. And I think the difference between getting your GLP-1s with us and maybe obviously your primary care provider is that we have other options. And with anytime you're in our GLP-1 program, you have access to biostimulants, you have access to microneedling, and we want to bring you through that journey and also treat you preventatively. We're like your primary care aesthetic medicine doctors.
Yeah, exactly.
Yeah. So we're here for the whole thing. Yeah.
All of it, seriously.
But that's the way to treat it. And you should really try and be more proactive about it. I know it seems sometimes like you're just throwing money at stuff, but it can make a difference if you're really trying to avoid a bigger operation. All right. So I lost 75 pounds on Tirzepatide over 14 months. I feel incredible, but my body looks like a deflated balloon. My trainer says build muscle. My friend says tummy tuck. What do I need?
So first 75 pounds is extraordinary, and you should feel so proud of yourself. But I totally understand when you look in the mirror and you don't recognize or kind of what you see, and how you feel inside doesn't represent, how you're looking.
Totally. Absolutely right. 75 pounds is a major accomplishment. That's awesome. But your trainer's not wrong.
Right.
As we've said before, building muscle will always help. It may not be enough, but it should always be part of your regimen. You may still need surgery, but you should still be trying to build muscle.
Absolutely.
Anyone with a muscular build, that muscle does take up volume, not as much as fat, but it will help a little bit.
And I mean, also too, as we age, we have to get stronger. Our bones have to be stronger. So, I mean, it's just a lifelong quest.
Yeah. But the honest truth is that muscle can't fix everything, and it can't fix excess skin.
No.
If the skin is redundant, there's more skin than the underlying tissue can fill. That's a structural problem.
Yeah.
And that exercise just can't relieve.
Right.
It can't solve. So no amount of muscular training or muscle underneath that deflated skin changes the skin itself.
Yeah.
So it is unfortunate, but that's why you got us.
Right.
For a 75-pound weight loss or rapid loss, tummy tuck is likely the most realistic path.
Yeah.
If the skin is bothering you.
But his tummy tucks, so sidebar, he snatches your waist, and he's an artist with his scars and stuff. So don't think tummy tuck, think yay tummy tuck. Oh, sorry.
Sidebar. Shameless plug. But yeah, no, and it's important. Like, yes, I won't say anything, but yes.
And the deflated description, that's so real. So there's an answer for this. We got you.
No. At 14 months after weight loss and you have a stable weight, that's when you should be doing this. You're ready. All right. So we've talked a lot about GLP-1s and the issue with GLP-1s. So the final question we really have to ask ourselves is, should anyone be on these things? If you have clinically significant obesity, BMI over 30, BMI over 28 with medical comorbidities like diabetes, hypertension, osteoarthritis, these medications deserve a serious conversation with your doctor because they can be life-changing. The metabolic and cardiovascular benefits are real. Do not let Ozempic phase or excess skin laxity be the reason why you don't have that conversation and why you're scared to be on these medications, because those are manageable and they're solvable problems.
Right.
And your health really should come first. Absolutely.
Yeah. Because I think about it, if you're overweight, right, it's worse on your knees. So, if you lose the weight, my daddy experienced like, oh, wow, I can like move around. I can take walks. I can jog.
Yeah.
I'm like, that's aggressive, Dad. But it really did help his knees.
Yeah. And it makes a big difference.
Huge.
And people feel a lot better and they have more energy.
Right.
Now, if you're relatively healthy at a normal or mildly elevated weight and thinking about GLP-1 primarily for aesthetic reasons to lose the last 15 pounds, I think you should be cautious. I'm not saying don't do it. There's a lot of people talking about whether microdosing is beneficial. A lot more healthy people are taking these medications. They aren't dangerous medications. And there is benefit, but that risk benefit calculation is different when the metabolic upside is smaller. Right. If you're not curing something that isn't a problem, should you be on it? And that question is a little murky. I have plenty of patients who do take this to kind of get to their goal and then stop, which I think is totally fine. There are plenty of people who just microdose, take a very small dose every 2 weeks. I think there are biochemical pathways that interacts with that probably does help. We just don't know for sure.
Yeah.
We don't have those studies to tell us that taking this as a healthy individual is going to be beneficial for us in the long term. And it may not be something that we find out for a long time. Either way, you should know what you're signing up for. They're likely long-term maintenance medications and not necessarily a finite course. And knowing the downstream aesthetic side effects is really important. And to have a plan for at day one is really important.
Yes. And know that we're here. We're here to help you.
Yeah.
And whatever that plan looks like, we got you.
And if surgery is a part of that transformation, then there's nothing wrong with that.
At all.
And
you're going to love it.
Exactly.
Your body.
All right. Well, I think that's all we got today. Thank you, Jenna.
Absolutely.
It was a pleasure, as
you.
always. If you have any questions, feel free to DM us at honestlypod or any of our handles. We're happy to take your questions, voice notes or whatever. Shoot those questions over and we'll try and get you on the pod. We're releasing these weekly every Monday night. So stay tuned for the next Honestly. Thanks for joining and we'll see you out there.